My name is Javid Saifi. I am board certified by the American Board of Surgery and the American Board of Cardiothoracic Surgery. I have been in practice since 1991, and I've been a member of Albany Cardiothoracic Surgeons since 1994. Well, Albany Cardiothoracic Surgeons has prided itself on providing excellent cardiac surgical care for patients. There's also compassionate surgical care. We understand what patients are going through. We understand that each person is an individual, and each person with each surgery is facing a life and death drama. Even though the results of cardiac surgery are so good, it's almost become a routine, but for each individual patient, it's a different challenge. And one of the cornerstones of our practice is to recognize that in each patient and understand what they're going through. And I think that helps us deliver very compassionate care as well as keeping up with the latest technologies. Well, we have a long conversation when the patients first come here. We go through their, aside from the history, physicals, we spend a lot of time going through what the procedure is, what they're going to go through, how long they're going to be in the hospital, what they may or may not experience and feel. And I think that helps build a trust. From a patient standpoint, I think they get the feeling that the doctor understands what they're going to go through, and they themselves have an understanding of what they're going to feel and experience. The patients that we see here are usually older, although we do see a variety of ages from the 30s to the 90s. We do provide a full cardiac surgical services, which includes bypass, valve replacements, aneurysm surgery, left ventricular assist devices, advanced treatment for the failing heart. We provide every service exclusive of transplantation. We are the oldest practice for cardiac surgery in the area. We have been in business now for almost 60 years. We are on our third generation of surgeons. From the people who started, for the surgeons who started the practice back in 1955 to now. And as medicine has evolved, so has the practice has evolved. So it has undergone many changes over that time. I'm very proud of the legacy, and I think the legacy has many factors to it. Part of the legacy is that each preceding generation of surgeons has found a social responsibility to provide excellent surgeons for the community. And excellent surgeons meaning not just technically proficient surgeons, but surgeons who are also compassionate, who understand, who are well trained. In their legacy, they've also made sure that each successive generation of surgeons that they hire continues that tradition. I've been in the Albany area since 1983, since I started my residency here, and except for 2 years out of the area, I've been here almost continuously during that time. And it's a beautiful area. I've been very pleased with it. I've raised my family here. Professionally, it's been an excellent experience for me. I very enjoyed the work that I've been doing and the practice that I've joined. I think one of the most rewarding aspects is to see somebody who has their activity levels have been limited, and after the surgery to see them bounce back to full activity. I think that's one of the most rewarding things, and that's what we strive for. We want to get people back to fulfilling their lives in a way that they would like to.